Each day we report the number of people infected is growing. The number of countries affected are growing. The Zika virus is creating fear and chaos and more questions than answers. But here to answer some of those questions is Dr. Anna Durbin, Associate Professor at Johns Hopkins Bloomberg School of Public Health. Dr. Durbin, thank you so much for sharing your expertise with us.
You're welcome.
I know you've been working on vaccines to tackle malaria and dengue. Aside from the birth defects that we've been hearing about that are so tragic that are connected to the Zika virus, how does the virus, how is it related or how does it compare to those other diseases?
Well, it's very interesting. The Zika virus is in the same family of viruses as dengue, and the clinical picture that people present with when they're infected with Zika can be similar to dengue, although generally the symptoms with dengue are more severe. And I think one of the factors that's leading to the transmission of Zika is that so many people, in fact, don't show a lot of symptoms when they're infected with Zika, so they can go about their normal business, go to work, go shopping, and be exposed to mosquitoes that can then pick up the virus and spread it to other people. Generally, only about 20% of people who are infected with Zika show symptoms. And with dengue or certainly with malaria, it's a much higher percentage who are actually symptomatic, and the symptoms can be more severe in adults. However, neither dengue nor malaria has, we haven't seen any increase in cases of microcephaly with dengue or other flaviviruses.
So the CDC is saying that there are more than 30 people here in the U.S. that have the infection, but if you're saying that 80% of the people don't even experience symptoms, there could be a lot more people walking around the U.S. getting bitten by mosquitoes that could possibly transmit this disease. I mean, I think one of the biggest fears here is how much do we really know about the Zika virus at this point? And what we know now is it can end up being worse later.
Right. Well, I think the important thing to remember is that you can only transmit the virus when the virus is replicating within you, and generally that's for about 2 weeks after your exposure. So people who come back to the United States and have been here, been back from their travel destination for 3 or more weeks, won't be transmitting Zika. It's generally, again, when you come back and are symptomatic within 2 weeks of return. I think that we will be seeing cases of Zika in the United States from travelers, and we may even see a few cases of Zika transmission, much like we did with dengue in South Florida and Hawaii. But I don't think that we're going to see the large transmission that we're seeing in Brazil, and that has a lot to do with the climate here in the United States, the distribution of mosquitoes we have in the United States, and the infrastructure that we have in the United States with people living in air-conditioned buildings and screens and not having as much exposure to mosquitoes as they may have in other areas of the world.
But Dr. Durbin, are we seeing any kind of correlation between the way the climate is changing here in the U.S. and its ability in certain areas like South Florida to be able to create this disease and allow these mosquitoes to live and transmit?
I think people are concerned about the effect of global warming on the spread of the mosquito itself. So the fact that we have global warming and we may be warmer in areas, for instance, of the mid-Atlantic and farther north that may allow the mosquito to live in those areas is concerning and may lead to transmission of other viruses. I don't think, again, that we're going to see the transmission here in the United States that we have in Brazil. Even with global warming, much of the United States does not have a suitable climate year-round for these mosquitoes. And again, the infrastructure in the United States is such that I don't think we're going to see a lot of transmission. We haven't seen that with dengue yet, and we've been looking for it. But certainly people will be on heightened alert for that.
Dr. Anna Durbin, Associate Professor at Johns Hopkins Bloomberg School of Public Health, thank you so much for your expertise.
You're very welcome. Thank you.